we're going to start with a very exciting speaker. Many of you probably know Dr. Melissa Lem. She is a Vancouver family physician who also works in rural and northern communities within Canada. Dr. Lem is the director of PARX, Canada's National Nature Prescription Program, powered by the BC Parks Foundation, and president of the Canadian Association of Physicians for the Environment. She's an internationally recognized leader in the field of nature and health. As a widely published author, climate change panelist on CBC's Radio Early Edition, in-house medical columnist for CBC TV Vancouver, and clinical assistant professor at the University of British Columbia, one of her major priorities is knowledge translation. So I'm going to turn it over to Dr. Lem now, and she's going to talk about prescribing nature for patient and planetary health. Dr. Lem, I'll just invite you to go ahead and share your screen.
Thank you very much, Dr. Dunn. It is such a pleasure to be joining you all today from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, otherwise known as Vancouver, on this rainy day here. And I know you're gathering from many places, but this is where I call home. And today, I'm just really grateful as well to PCRM for inviting me to speak with you, with fellow colleagues, because this is one of my favorite topics. This is definitely the area that I'm most passionate about. And today I'm going to lead you through some evidence behind the health benefits of nature, about how they're good for patients and the planet, and then also some information about nature prescribing and how you can get involved in our program, and share a little patient story as well about someone who's been impacted positively by our program. To begin with, to get everyone on the same page, because I know some of you are just taking a break in your day and are very busy people like myself, a clinician. In one word, I want you to describe how you feel when you're outside in nature. And I believe the tech people have enabled the chat function for this slide. So you can go ahead and enter that in your chat. Think about your favorite place, a recent time you spent time outside, and in one word, describe how you feel when you're outside. I see these great words coming up: calm, refreshed, relaxed, at peace and free, more relaxed and calm. I always love to see these words because it's exactly how I feel when I spend time outside in nature. And I think it's a really common experience that we have, that when we spend time outside, we intuitively feel that it's good for us. And this is a word cloud that we created from prior presentations that we've given, but a lot of the same words come up, from calm to peaceful to happy, relaxed and restored and re-energized. And the wonderful thing about this intuitive sense we have that we feel healthier and better and more focused when we spend time outside is that it's actually backed up by a lot of evidence. And I want to share my own personal story about how I came across this evidence. And this goes back to about 15 years ago when I was starting off my work as a family physician. My first job was as a full-service rural family doc in northern BC in a little town called Hazelton. And as some of you know who work in rural locations or have trained in rural locations, it can be pretty stressful at times. I was delivering babies in the middle of the night with no specialist backup, just family doctors in our little hospital. I was managing sick inpatients on my own. I was a new grad in my mid-20s and running the emergency department, etc. But for some reason, I loved the work. And it was only after moving back to Toronto, where I was born, after a year or two working in northern BC, and I continued to go back for rural locums and continue to do rural medicine now. But it was when I moved back to Toronto that suddenly I felt more stressed, even though the work was objectively easier. I was now working as a physician in student health at the University of Toronto, where I saw a lot of worried well with not a lot of chronic diseases or acuity, but I felt edgy all the time when I was in the city. And so one day I remember standing in front of my window, which unfortunately looked out at a scene kind of like this, where all I could see, instead of green space, the mountains and trees and bears that I saw out my front window in Hazelton. Now all I could see really was concrete and glass and a little square of sky with the CN Tower in it. And I thought to myself, I think the reason why I feel so edgy all the time when I'm here in Toronto is because I'm missing nature. And so what I did, as all of us great nerdy doctors do, is we thought, okay, this intuitive sense I have can't be true unless it's backed up by RCTs and other kinds of credible evidence. So I sat down at my computer and did a lit review on PubMed and Medline, and study after study popped up about the health benefits of nature for a wide variety of different health conditions. And I thought to myself, again, this is 15 years ago, I have never heard about this. I had no idea people were researching the health benefits of nature time. We didn't learn about this in medical school. I need to make this my job to spread the word to my colleagues and the general public and decision makers so that people know and can put in place policy that's going to make sure people can connect to nature for health. And so these are just some nice infographics that I've been given permission to share that go through just some of the different health conditions that can be made better by nature, from bone density issues to chronic diseases like diabetes, high blood pressure and heart disease, to mood conditions like anxiety and depression, ADHD in children, faster recovery after cholecystectomy, and in fact, earlier discharge and less pain medication. If you look out at a window with trees instead of a brick wall, better work satisfaction. There's a huge amount of evidence now, several decades deep, and probably in the thousands of studies showing that spending time in nature is one of the best things that we can do for our health. And you might wonder, all of us are clinicians, most of us on this call are clinicians, and you might wonder, well, why are doctors getting involved in advocacy that has to do with things outside the healthcare system? And the reason why is because only about 20 to 25% of our health status comes from what we do in our offices and our hospitals. And the vast majority of what makes our patients healthy or sick come from factors outside, like different life factors, like your work or your early childhood development or access to food, your biology, genetics, and a healthy environment. And so arguably, when we focus on factors outside of our offices and engage in that kind of advocacy, and if you look at that middle column, you can imagine how access to nature might influence a lot of those different factors that make us sick or well, then you can start to see why it's important to step outside the clinic, to step outside the hospital, and start to do that work of advocating for healthy environments and infrastructure in our cities and beyond. Now, you might be wondering, as science-based health professionals, what are the mechanisms behind why we are healthier when we're outside in nature? And I want to mention two different psychological theories. The first one is called attention restoration theory. And this is an experience I had. So when I moved to Toronto, I was suddenly surrounded by lots of lights and traffic and noise and sounds that taxed my powers of conscious attention, of which we only have a finite amount. And what that does is it increases irritability and fatigue and reduces the ability of your brain to function effectively. Whereas when you walk into nature, when you spend time in biodiversity, it's interesting, but it doesn't require you to constantly focus your attention and tire out your brain. So it's restorative. It reduces that fatigue and irritability and replaces your cognitive function. The second theory is called stress reduction theory. And that says that when we experience stressful events, in fact, spending time in nature helps us recover faster, helps us recover our brain power faster. And there are other things that happen when we're outside in nature too, like we're exposed to volatile organic compounds called phytoncides that different researchers have found, in fact, boost levels of immunoproteins when you, for example, sleep in a hotel room for 3 nights with phytoncides being aerosolized into the air versus a similar hotel room for 3 nights without them. So it's a boost to our immune function. Also, there is evidence around healthy bacteria, probiotics that a lot of us are familiar with that help stimulate our immune systems in healthy ways. And in fact, just looking at photos of nature on a wall or listening to nature sounds can measurably improve mental health and other outcomes. So from our heads to our toes, from our noses to our skin and our brains, again, spending time in nature is arguably one of the best things that we can do for our health. And that's why in our program, we call nature time the 4th pillar of health, just as important as recommendations for a healthy diet, lifestyle, and sleep at maintaining a healthy lifestyle. And I just want to share a couple of my favorite studies that have to do with the health benefits of nature. And I like this one because it takes factors that we know have major influences on our health and compares them to an objective parameter like tree cover. So this is a study from my hometown in Toronto that combines satellite imagery, tree data, and health study data and self-reports of health perception. And after crunching the numbers and controlling for a number of different confounders like pre-existing income and pre-existing health status, what they found was that every 10 more trees per block improved people's health perception, similar to an increase in their personal income or median neighborhood income of $10,000 per year, or being 7 years younger. And this is really interesting because we know that both age and income have major influences on our health. So I like how this is a very objective way to kind of compare something measurable and factors that we know are important for our health. The second one was a pretty small pilot study that was done in Chicago with kids with ADHD, but I like it because it really speaks to nature as almost literal medication. They took 17 kids with ADHD and they guided them on 3 different 20-minute walks through a city park, through a downtown area, and through a residential area. And what they found was that the 10-minute walk in the park, in fact, improved their digit span backwards score performance, similar to levels in kids without ADHD. There's some interesting things about this. So first of all, if you don't know what the digit span backwards test is, you just recite a sequence of numbers in a row and then get them to repeat them backwards to you. The more numbers, the better your memory and attention. But what's interesting is it separates out the effect of exercise, because a lot of people often say, well, isn't it just getting outside into the fresh air and exercise that improves your memory and your attention? In fact, it was only the park walk that improved their DSP significantly to the level of kids without ADHD. And in fact, after analyzing the numbers, they found that the magnitude of the effect on these kids' memory and focus rivaled the peak effects of Ritalin. Of course, no one is saying that spending 20 minutes walking in nature in a park is going to replace everything that prescription stimulant medication does. But I think this really tells us how powerful nature time can be as an adjunct to what we normally prescribe in the office. And because we're talking about fertility today and reproductive health, I thought I would mention a few studies also about how nature time is good for pregnancy and the perinatal period, and for babies and kids when they're very young. This is taken, in fact, from one of the fact sheets on our website, and from keeping moms who are pregnant, active, and engaged, to surrounding them with healthier environments and reducing air pollution, noise pollution, and heat, to, in fact, better birth weights. And then after the kids are born, better motor skills in young children and improving sleep in children. You can see that spending time in and around nature and having access to green space is also good for perinatal and reproductive health. Now it's time for a bit more audience interaction. There's another poll, because when we prescribe something as physicians, we need a dose, right? We need to know how much per time and how much total. So what do you think the total dose of nature time needs to be per week? When do people report significantly better health and well-being? Is it 1 hour, 2 hours, 3 hours, 4 hours, or 5 hours? And I'll invite you to put your answers in the chat if you like. Okay, there's a couple 2s, 3 2s. People are saying 1 hour or 2 hours. 1 or 2 seems to be the most popular answer. There's a 3 there. Okay. In general, I think the most answers are 2. And in fact, the 2s are right. The answer is 2 hours per week. And this comes from a study that was spearheaded in Europe. And they looked at 20,000 adults in England and asked them to report how good their health was and where their well-being was, and also how much recreational time they spent in nature every week. And again, after controlling for a number of different confounders like health status and proximity to green space, they found that their likelihood of reporting good health or high well-being was significantly greater when their nature contact was greater than or equal to 2 hours or 120 minutes per week. And that's why we have a recommendation in our program that patients spend at least 2 hours in nature each week to maximize their health benefits. And of course, if your patient's spending 2 hours in nature each week, you don't tell them to cut it off at that point. You want them to continue to spend time in nature, because those positive benefits do accrue up to a peak of around 5 hours per week. So anyway, but remember that recommendation, at least 2 hours per week in nature. And the second question is, what kind of dose should we have each time? Like how long should our nature pill be? Do people think the most efficient drop in stress or cortisol levels happens between 5 or 10 minutes, 10 to 20, 20 to 30, 30 to 60, or 1 to 2? And you can just put the number in the chat there. What are your thoughts? Okay, there's a wider range here. We've got 2, 4, 3, 4, 30 to 60, 4. Okay, a lot of 3s here. And 4s. Okay, fairly evenly split. The answer is, in fact, 20 to 30 minutes. And it's very convenient that these studies came out right around the time when we were launching the program in November of 2020, just beforehand, when we were looking for dosing recommendations. And this is a study that looked at 36 city dwellers over a couple months, and they asked them to have a nature experience in an outdoor place that brought them a sense of contact with nature at least 3 times per week and for 10 minutes or more each time. And they measured their salivary cortisol repeatedly throughout those days and in and around those different experiences. And what they found was that their cortisol, or primary stress hormone, levels dropped more than 20% after a nature experience compared to a non-nature experience. And the efficiency of that drop was greatest between 20 to 30 minutes. So you can see this third discontinuous red line here. So that's why we have a recommendation in our program that you spend at least 20 minutes in nature each time to get the biggest bang for your stress reducing buck when you spend time outside. And something else that's really interesting in this study in particular is they asked them to self-define nature experiences. They didn't say you have to go to this trail with no one around or a national park or in the backwoods. They said, when you feel like you've had a meaningful nature experience, you document it. And so that's why when we have a recommendation in our program for spending time in nature, we don't always prescribe to specific places, although sometimes we will work with patients to come up with areas that they could spend time in nature. But we say, spend time in an area that's meaningful for you, and then you'll get those health benefits. Some people might ask, why is the BC Parks Foundation, which is the host organization for PARX, or Canada's National Nature Prescription Program, why are they launching a nature prescription program when they're really focused on conservation? And the reason is because health is a really effective message to get people to support policy proposals and initiatives. And we can take some of this learning for the health frame from climate change research. This was a study that was just published in the last year or two, and they surveyed close to 8,000 participants in 5 different countries. And they asked them to read 5 different pairs of statements, each with 2 different frames, and then ask them which frame would make them more likely to support policies tackling climate change. And what they found was that in this general public sample, so we're not talking experts or decision makers, but to the general public, framing policy proposals in terms of health and environmental framing increased their support. Economic framing had no support for the general public, which is interesting because we always hear from government and in the media arguments that have to do with economics. Opportunity in framing, or all the benefits that would come from that policy proposal, increased support more than threat framing, or all the negatives that would happen if we don't put this policy in place. And also focusing on present impacts was more motivating than focusing on future impacts. So that's why we try to do this in our program. We try to stick to the research behind effective messaging. We talk about the health impacts. We talk about all the positives that will happen because this is more motivating for the general public to change their behavior. You'll notice there are a couple stars on this slide on health and opportunity. In fact, these were the only 2 kinds of frames that moved people who weren't concerned about climate change to support those policy proposals. So this is why it's really important for us, I think, to know our audience and to also continuously speak to health, which is what we're good at, and speak to all the benefits that will come in, say, connecting people to nature or other policies that we know are good for people. And as Caitlin mentioned, or as Dr. Dunn mentioned, I'm also president of the Canadian Association of Physicians for the Environment. And one of the major reasons why I work on this file on nature prescribing is because connecting people to nature and having more nature in our environments is good for the planet. We know that healthcare is a major contributor to global carbon pollution. If global healthcare were a country, it would be the 5th highest emitter in the world. So anything that's going to reduce our burden on the healthcare system by improving patient health in an evidence-based way is going to reduce that carbon pollution that we generate. We also know that having nature in our cities makes them healthier from an infrastructure perspective, not just from a human contact perspective. I'll get into that a bit on the next slide. And also across the lifespan, people who are more connected to nature and have more nature experiences are more likely to engage in activities that protect the environment. So not just nature conservation, but also other pro-environmental behaviors like recycling, like saving energy, and actually like voting for climate advocates. So I like to think that every time one of our prescribers, or thousands of prescribers across the country, writes a nature prescription and connects a patient to nature, that they're doing a small part, positive part for the planet at the same time. It's also true that the executive director of the UN Environment Program has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. We hear a lot about reducing fossil fuel use and phasing it out when it comes to climate change, and that's absolutely incredibly important. But it's also true that if we fully embrace nature-based solutions for climate change that focus on restoring and expanding and protecting nature while at the same time dealing with human issues, that this could get us over 1/3 of the way towards our 2030 Paris Agreement targets. And right now, global investments in nature conservation are only probably no more than 5% of total climate investments. So if you think about the potential in carbon reduction and what actual investments are being made, I think engaging the health voice and increasing support for nature conservation is a really important way to get us to where we need to be with our carbon reduction. Just a bit about how nature makes our cities healthier. There are tons of different benefits which are intuitive of urban greening, from reducing the need for air conditioning and physically cooling down streets through shading, through trees, and lowering energy demand, which reduces air pollution and greenhouse gas emissions, especially in electricity grids that run on fossil fuels. We do have some of those within Canada. Green space and trees also remove air pollutants and suck carbon dioxide out of the air, reduce flooding in terms of heavy rainfall. And the economics tell us that every $1 invested in an urban tree returns up to $3 in benefits, which is an argument you can make for decision makers. This map, if you take a look at it, is a map of how the Lower Mainland heated up during the 2021 heat dome. It was just a couple of years ago that killed over 600 people in BC in the space of 1 to 2 weeks. And when analyses were done of hospitalizations, you can see the downtown east side, which is one of the most economically deprived and materially deprived areas in Vancouver, in fact, heated up the most in Vancouver proper. And this is where most of the hospitalizations during the heat dome in fact came from. So access to nature is not just, a nice frill. It's in fact a must-have when we think about climate change and how it's heating up our cities and how it will heat our cities in the future. Nature equity is a huge issue. And in fact, typically richer neighborhoods have more trees and green space, and poorer neighborhoods have less. And so I think it's important for us to work as trusted health professionals and support policies that green every neighborhood in our cities, not just the wealthy ones. Now I'm going to talk a bit about our amazing nature prescription program. As I mentioned, it was launched in November 2020 and is now available thanks to the hard work of different CAPE, Canadian Association of Physicians for the Environment, advocates, and other health professionals across the country. So if you are in any province across Canada, you can now prescribe nature through our program. And it's a bilingual program too, so you can register through either of these links. And when you register, you will receive a customized nature prescription file that you can put in your EMR or just print and use to start prescribing nature to your patients. We have, I think it's 14 different fact sheets broken down by different health conditions for adults and kids that speak to the evidence behind the benefits for certain health conditions. So I encourage you don't have to register to look at those. I encourage you to head to our website and learn about the health benefits of nature. And we have been endorsed by a huge number, over 80 different major health organizations within Canada, in every single province in Canada, which I think has really allowed us to scale in a major way. But it was, in fact, when we announced a new collaboration with Parks Canada last year in January of 2022, when registrations really started to go off the charts, because now what could happen is that our prescribers can prescribe something tangible to their patients, not just saying get outside and our patient-physician relationship is going to be what's motivating you to spend time outside, but now I can reduce a barrier to nature access for you. So any regulated health professional registered in our program can prescribe one free Parks Canada Discovery annual pass per month to patients across Canada. And this resulted in a huge amount of media attention across the country and internationally. And as you can see, our prescriber numbers started to go exponential. And at this point, close to a year later, we now have about 13,000 regulated health professionals in our program, including over 6% of all physicians now. And within my home province of BC here, we have about 15% of all doctors registered. So if that doesn't convince you to register to do what your colleagues are doing, then just keep listening and you'll hear some more motivation. We were really grateful to the Canadian Medical Association when they endorsed our program. at the end of last year at the UN Biodiversity Conference in Montreal. And in fact, they were the first National Physicians Association in the world to formally recommend nature prescribing in policy. So about a year ago in October, they included a recommendation for nature prescribing to be taught to all medical students and also to be used in practice by physicians to improve environmental stewardship values and patient health. So this is something that we're really proud of and grateful to the CMA for. We're also involved in a number of different international research trials going on right now, totaling about 10 million. And the World Health Organization pointed out our initiative as an effective way to inspire protection and restoration of nature for our health in their COP26 special report on climate change and health. So there's a lot of international momentum as well. In terms of next steps, we've done a lot, but we always want to do more. So we want to launch park prescriptions in the territories, and we're having active dialogue with different health organizations there and Indigenous organizations and community organizations to make sure we launch in a good way in the north. We also recognize that park passes and day use fees are not the only barrier to nature access. Transportation often comes up as one. So we're having conversations with different transportation organizations too to further reduce barriers to nature access. And we're also working on our park prescriptions app that's going to track and incentivize nature time in our patients. But I think not, over and above all of the different early successes that our program has had in 3 years, what I find most gratifying is when I prescribe nature to a patient or a colleague prescribes nature to a patient, and we hear back from that patient how it's improved their health and changed their lives. And just, we're getting close to the end of my time to talk here, but I want to share this short video that CNN put together when they visited us about our nature prescription program. I just want to share Marjorie's story. She's one of the first patients who was prescribed nature in our program by a colleague of mine. And here it goes.
About a year ago now, I was in talking to my doctor and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh goody, one more pill. And he says, no. I want you to spend 2 hours during the week outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, she's 75, so I've got to tell you that I'm 91. So that's why she takes care of me.
I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. Park Prescription, or PARX, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with Parks Canada where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees. So we're hoping that by prescribing these Parks Canada discovery passes, that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains, and the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically, when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, you're absolutely right. When I spend more time in nature, I feel better. And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says this is a good thing to do. This is worth the effort to do. You need to get out of doors and just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life.
Meant to pause that. All right, I'll head back to my slides here. Okay. Now, in terms of calls to action, because I always like to give people something to do after I give a presentation, is we as healthcare professionals have been through a lot in the last few years and in our overworked healthcare systems. So I want all of you to spend at least 2 hours in nature each week, at least 20 minutes each time to optimize our health, because we need a healthy health force. Also, when you have the opportunity, whether it's voting or writing to decision makers, support healthy government policy to green cities and conserve nature and biodiversity. And of course, one of the easiest low barrier steps is to register for PARC prescriptions and spread the word to other health professionals. And also, if you know a nature-based organization or venue, please connect us, because we also have partnerships with the Toronto Zoo, with the Canadian Museum of Nature, with UBC Botanical Gardens, where if you show your nature prescription, or if your healthcare professional prescribes it, you can get free or discounted access to these areas. So we're always trying to reduce barriers to nature access. Feel free to reach out at parx@parkprescriptions.ca. And I want to leave you with one thought. And this was a very special moment that happened just this past spring, actually, when I was in Tofino with my family on a much needed spring break vacation. And we just spent the day out at the beach playing in the waves and the sunshine and among the starfish and the seaweed. And the sun was starting to set, so we had to head back. And on the trail back, we saw this sign. And this sign read, "There is no concept of the word wilderness in the Nachalnith language. The closest translation is Wathiu, meaning home." And I hope the next time you spend time outside, whether it's in your garden or whether it is on a trail somewhere or in your park in a city, that you remember that you're doing something really healthy for yourself and that you will also be home. Thank you.
All right, thank you so much, Dr. Lem. That was really, really interesting. So refreshing, pun intended. There was a lot of audience participation there, and we do have the audience. Just a reminder that your cameras and microphones are off, but if you wanted to raise your hand, you can ask a question verbally, or you can put your question into the Q&A box, and Dr. Lem will answer your question there. So I just want to open it up for any questions in the audience. So I have a question for you, if you don't mind. Is there ever a situation where you see patients where you think, I might want to prescribe like an SSRI or cognitive behavioral therapy or something like that, but you say to yourself, well, let's try, this patient might be amenable to the nature prescription. And if so, how do you make that decision? And when do you see them back to see if that's working before you intervene with another treatment, for example?
Dr. Jen, I think that really depends on the patient and your relationship with them and what you think they'd be open to. I would say there have definitely been times when I prescribe an SSRI or another medication, an antihypertensive, in conjunction with a nature prescription, because we're not saying only prescribe nature, no more, of the pharma or whatever. Like, we definitely say that it's part of an overall treatment plan. But I think for some mild cases, like mild hypertension or dysthymia, or just kind of mild pre-diabetes, that in fact, that's where we can prevent a progression often to worse disease and perhaps even treat it with a prescription for nature. And in terms of follow-up, it depends on the patient and the severity, but usually within a month, I'll have a patient back. And I have to say, people often ask me this, like, have you seen benefits in your own patients? It could be because of the other things I prescribed in conjunction with nature. It's hard to know sometimes exactly what had what effect when we recommend or prescribe things, but they've all improved in some way. So it's really nice to see in my own practice the effects of nature prescribing.
Right. It gets them outdoors, it gets them active, all of the above. The question from the chat box here is there a limit of prescriptions that you can provide for public parks?
For the Parks Canada Discovery Passes, so yes, there is a limit of 1 per month. Otherwise, some people, I can imagine them spending their whole day just prescribing free park passes. I think they're worth just over $70 for an adult pass.
Wow.
So it's 1 per month.
Okay.
But it doesn't just have to be a doctor, is the nice thing. A lot of people talk about how there's an issue with access to primary care, like family doctors, but nurses can do it, dentists can do it, pharmacists. So if you're a regulated health professional, you can prescribe.
And then if you don't mind, could you put in the Q&A box the link to the PARX before you leave? Because we have people asking for those.
Okay.
Excellent. And then there's just another comment here. If you had a code for patients, like a QR code for patients to scan and watch a short video on nature benefits, the physician here is saying that she would like to display it in the office to try to help spread the message. So is there anything like that maybe on the PARX website where there's a link or QR code?
There's a really good video that the World Economic Forum put together when we're getting all this information about park prescriptions. It's 1.5 minutes, and it goes through in a really concise but nice way with nice music and images the health benefits of nature. So I can find it and send it to you later or something like that. But yes, there's
Perfect.
It's a really lovely video.
Perfect. So yeah, and anything that you find, the Q&A box will remain open for the rest of the symposium here, so you can pop it in there, or we can always post it on our website, but the attendees would probably appreciate seeing any of those resources. That's wonderful. Well, thank you so much, Dr. Lem, for joining us. That was a really great talk. I think we all learned something really new. So thank you so much.
Thanks, Dr. Dunn. It's my pleasure, and have a great rest of the symposium, everyone.